Phenylpiracetam has been shown to boost alertness, cognition, clarity, focus, learning, and memory. It provides a stimulant effect, and it reduces symptoms of depression and anxiety. Phenylpiracetam is a water-soluble nootropic in the racetam class of compounds. It was created by adding a phenyl group to piracetam by Russian scientists in 1983. It was developed as a nootropic to boost cognition and to improve physical stamina. It turns out that phenylpiracetam is very effective in boosting athletic performance. It provides significant stimulatory effects, and it helps you to resist the cold, leading to a ban by the World Anti-Doping Agency for use by athletes in the Olympics and other professional sports. Russian cyclist Anton Reshetnikov was suspended in 2007 for 2 years from the International Cycling Union for using phenylpiracetam. By adding a phenyl group to piracetam, it boosts the bioavailability. It easily crosses the blood-brain barrier, and is considered 20 to 60 times more potent than piracetam. Users report that phenylpiracetam enhances alertness, focus, memory, and learning. It reduces brain fog, and it provides physical stamina and cold tolerance while combating physical and mental fatigue. Phenylpiracetam helps to reduce symptoms of anxiety and fear. Unlike popular prescription anti-anxiety and antidepressant drugs, phenylpiracetam has no sedative action or other adverse side effects that is associated with these other medications. Phenylpiracetam increases the density of acetylcholine, NMDA, GABA, and dopamine receptors in the brain. More receptors means more binding sites for neurotransmitters that affect memory formation, cognition, sleep, and mood. Phenylpiracetam increases blood flow in the brain. As a derivative of piracetam, this nootropic has the same mechanism of action when it comes to blood flow. It suppresses the constriction of blood vessels, allowing for freer flow of blood. More oxygen and nutrients get to the brain cells, boosting alertness, cognition, focus, and mood. Russian chemists synthesized phenylpiracetam in 1983 to boost the physical and the mental performance of astronauts during spaceflight. It's currently used by Russian cosmonauts on the International Space Station. Phenylpiracetam combats physical and mental fatigue. It enhances memory, mood, and focus. It facilitates learning and retention, reduces brain fog, increases alertness, and boosts physical stamina and tolerance to the cold. Phenylpiracetam is also used as an effective treatment for epilepsy. This debilitating condition is caused by sudden surges of electrical activity in the brain. This temporary disturbance in messaging systems between brain cells can cause a seizure. Normal brain function gets halted or mixed up. This is where phenylpiracetam comes into play. Phenylpiracetam has been shown in clinical studies to affect alpha and beta brainwaves. Scientists haven't quite figured out why it works, but phenylpiracetam has an anticonvulsive action in the brain. They concluded after one clinical trial that phenylpiracetam reduced the frequency of seizures and it improved cognitive function in the absence of epileptiform EEG abnormalities. Phenylpiracetam is sold as a prescription drug in Russia and several Eastern European countries. In the United States, phenylpiracetam is sold as an unregulated, over-the-counter research compound. Phenylpiracetam increases the density of neuroreceptors. Studies have shown that it increases the density of acetylcholine, dopamine, GABA, and NMDA receptors. This translates into more receptors for each of these important neurotransmitters to bind to and boost their effectiveness. The increase in density of the neuroreceptors likely accounts for phenylpiracetam's stimulant-like properties. Similar to Ritalin or Adderall, this nootropic increases the effectiveness of dopamine in your brain, increasing alertness, decision-making capability, and cognition. But unlike stimulants like Ritalin and Adderall, phenylpiracetam doesn't come with any stimulant-like side effects. You should not experience any fatigue, rapid heartbeat, decreased appetite, or irritability. Instead, you should feel increased stamina, have more physical endurance, and feel smarter. For similar reasons to how phenylpiracetam works as a stimulant, it can also tame symptoms of anxiety and depression. It increases the density of receptors for acetylcholine, GABA, and NMDA. The increase in receptor sites for GABA, choline, and glutamate affects levels of the calming neurotransmitter GABA and serotonin in your brain. Phenylpiracetam floods your brain with the neurochemicals that you need to relax. As we get older, our brain chemistry and our metabolism changes, and it seems these changes are affecting younger and younger people. Recall, reaction time, and learning capacity decline. Neurotransmitter levels decline. The density of acetylcholine, dopamine, GABA, and NMDA receptors decline. Acetylcholine levels decline. Cerebral blood flow declines, and stamina and endurance decline. All of these changes are contributing factors to age-related cognitive decline. Early signs of these effects can be seen in poor decision-making, difficulty learning, and even recalling simple things like an important appointment. But even if you're not concerned with these signs of aging, phenylpiracetam can still help. Phenylpiracetam is highly bioavailable when used as a nootropic. Once digested, it quickly gets absorbed and crosses the blood-brain barrier. Phenylpiracetam modulates the neuroreceptors. It's been shown to increase the density of the receptors for the GABA, NMDA, dopamine, and acetylcholine. And more neurotransmitters results in more of each of these neurotransmitters being able to bind to the neurons and to affect alertness, cognition, memory, recall, and mood. It has a positive effect on physical performance by increasing endurance and reducing physical and mental fatigue. It's been shown to act as a stimulant, but unlike pharmaceutical drugs, it doesn't affect your cardiovascular or your respiratory system, and it doesn't have the side effects of jitters, restlessness, or irritability like regular stimulants. It's also noted for increasing your threshold to the tolerance for cold. Many users say that phenylpiracetam is the strongest nootropic they've ever experienced. It's highly bioavailable, and you experience the effects within 30 minutes of taking it. Phenylpiracetam increases the concentration, motivation, memory, physical endurance, and tolerance to cold. Learning is quicker, and stress is reduced. Learning and processing information becomes easier with phenylpiracetam. You're not rereading sentences and paragraphs trying to understand them. With phenylpiracetam, short and long-term memory improves. Motor skills improve, so you're typing faster and more accurately. Those dealing with depression report a decrease in depressive symptoms. More confidence helps in social situations, and conversations are easier. Productivity rises, and you'll assume a get-it-done mentality. Procrastination is a thing of the past. Phenylpiracetam is a popular pre-workout supplement. It increases your endurance and it reduces both physical and mental fatigue. And if you're one of the unfortunate ones who lives in a cold climate, you'll find that your tolerance for the cold increases. Phenylpiracetam was developed in Russia in 1983, and the majority of research done with this compound has been conducted in Russia, published in Russian medical journals, so there's limited English clinical trial data. A study was carried out by Russian researchers, and they investigated the effects of phenylpiracetam on cognition. 90 adults aged 40 to 60 who were suffering from cognitive deficit due to surgery or brain trauma were enrolled in the study. The volunteers were given 200 milligrams of phenylpiracetam daily for 30 days. The researchers found that those that were using phenylpiracetam showed a significant improvement in motor coordination, higher brain function, memory, attention, and counting, and they had a reduction in both anxiety and depression. Researchers in Moscow recruited 400 patients who were suffering from ischemic stroke. This is the most common type of stroke, where blood vessels carrying blood to the brain are blocked by a clot. Half of the group received 400 milligrams of phenylpiracetam daily for a year. The control group got a placebo. The research team found that the group who received phenylpiracetam experienced a significant restoration in cognitive function, and they resumed daily activities, far better than the control group who took the placebo. The recommended phenylpiracetam dose is 100 mg twice per day, one dose in the morning and one in the early afternoon. Don't use phenylpiracetam later in the day because its stimulant effect can cause insomnia. You can develop a tolerance to phenylpiracetam, so consider taking it only on days when you need extra focus, or try cycling it 1 week on and 1 week off. Phenylpiracetam is non-toxic, so it's considered well tolerated and safe. As with many of the racetams, phenylpiracetam can cause headaches because it boosts the use of acetylcholine in your brain. Choline supplements like alpha-glycerylphosphocholine or CDP choline can help to avoid this side effect by providing the adequate choline precursors to create the necessary neurotransmitter acetylcholine. Tolerance is a problem with phenylpiracetam, and it builds rather quickly. It'll soon lose its effects if it's used in excess, so you should try using phenylpiracetam only when you need extra cognitive power, or before a workout, or try cycling it 1 week on and 1 week off to avoid the tolerance. Many users find that stacking the phenylpiracetam with a choline supplement boosts the effect even more with the improved memory and cognition, and this is supported in several research studies. Phenylpiracetam is especially helpful for those suffering from ADHD or brain fog. This nootropic has a stimulant-like effect similar to that of pharmaceutical stimulants, but without the side effects of increased heart rate, irritability, and restlessness. Phenylpiracetam can boost athletic performance. It's been shown to improve physical performance, increase stamina and endurance, and even provide cold weather resistance. It's also particularly useful to students or executives who want to boost alertness, cognition, clarity, focus, learning, and memory. This compound also has antidepressant and anti-anxiety benefits. Studies have shown that phenylpiracetam can be effective in relieving the frequency of epileptic seizures in those dealing with epilepsy. It even complements some epilepsy medication. You should use phenylpiracetam with a good choline source like alpha-GPC or CDP choline. This helps to boost the effectiveness of neural acetylcholine, so demands the presence of more choline in your brain. You can safely boost your daily intake of phenylpiracetam to 400 mg, but be aware that the tolerance to the effects of this nootropic build quickly, so it's recommended using phenylpiracetam only on days where you require extra cognitive power.